Okay. Welcome, everyone. Welcome to the public meeting of this meeting of the Oversight and Engagement Board today, the 10th of September. Thank you very much for everyone attending. I will go straight into the agenda. So item number 11 is the minutes from the previous meeting of the 4th of September public session. I will assume, unless I'll look around the room, if anyone's got any queries on that's taken as read and we'll sign them off. Thank you very much. So we come straight to item number 12, which is the summary of local surveillance data. And that's over to our Director of Public Health, Lucy Whiteman. Are we going to share the slides for this part of the meeting, Lucy, or not? Just asking that question up front. Thank you, Lucy.
No, Cheryl's shaking her head.
Walk us through them. It's fine. Don't worry.
So for those people who obviously haven't had them as part of the attendance pack for this meeting, for the public, they are on the Northamptonshire County Council website, and the surveillance pack is updated on a weekly basis. So this surveillance pack is for the week up to the 30th of August 2020, and obviously we've got a stark reminder on the front that talks about the fact that obviously, as with many places in the country, that cases continue to increase in Northamptonshire, in particular in Northampton, Corby, Kettering and Wellingborough. So we're asking those residents to obviously take additional steps. The borough of boroughs of Corby and Kettering are now on the government watch list as areas of concern, and Northampton has been moved from an area of intervention to an area of enhanced support, because there are sort of little green shoots of improvement. But obviously, as Boris Johnson has talked about in recent days, we cannot be complacent. Even where we're seeing mild improvements, we've still got a significantly high rate of infection than we would want. So from a point of view of the messages, obviously we continue to ask people to keep 2 meters apart from each other at all times, to limit contact with anyone outside of your household or bubble. Obviously, at the moment, that is very much aligned with the new legislation that's going to be coming in as of next week, and we will be reviewing our recommendations in line with those changes as well. Obviously not to share items outside of your bubble or household. If social distancing of 2 meters is not possible, to always wear a face covering, to avoid using public transport or car sharing, but wearing a face mask throughout the journey if you must use either of those modes of transport, to obviously continue with the very basic hand hygiene methodology, so washing your hands for at least 20 seconds or more very frequently, particularly as you come in from being outdoors, if you've had to go out to do your essential shopping, and obviously if you can, to work from home where possible. So Northamptonshire cases, we have now got 4,385 as of the 30th of August. There were 145 new cases in the week between the 24th and the 30th of August inclusive. 3 of those were identified through Pillar 1 testing, so that's testing in care homes and in high-risk settings such as respiratory areas, pre-operative assessment, etc., in NHS settings, and the staff that work in those high-risk settings. The rest, there were 142 cases, were identified through Pillar 2 testing in the community. So we still have a significant increasing trend of COVID. We're seeing some small reductions in some boroughs and districts, but overall the trend in Northamptonshire is still concerning. From a point of view of the age groups being affected, we obviously provide a breakdown of gender and age. It is still more females that are being tested positive. Now that's more likely to be the fact that women tend to have more proactive health-seeking behaviours, so they are more likely to go and get tested if they have any concerns or have developed symptoms. So again, encouraging people to make sure that if they develop symptoms, because we obviously have now got some limitations on capacity for testing. So if you have symptoms, that you must seek testing and be self-isolating immediately. There's been an increase in cases in the 20 to 29-year-olds, so that's not unique to Northamptonshire. Again, that's being seen nationally, and obviously is a concern as we start to see schools returning and universities returning, that we're likely to see continued increase in the younger age groups, so 11 to 20 and 20 to 29-year-olds. Overall in Northamptonshire as a county, the rate has gone down slightly, or the number of cases has gone down slightly, but Corby, East Northamptonshire, Kettering and South Northamptonshire have all had an increase in the number of cases as compared to the previous week. So the overall rates, Northamptonshire is still significantly higher than the England rate. Corby still remains significantly higher than the England rate, as does Kettering and Northampton. Wellingborough is now similar. As we know, we had an increase in cases there associated particularly with the Green Corps outbreak, but we still have seen cases in other areas, South Northamptonshire and East Northamptonshire in the last week being areas of concern locally. Overall, the cumulative case rates obviously continue to go up at different paces. One of the areas obviously that has started to slow slightly is Northampton. But again, we've still got quite a long way to go before we can get to a point where we're confident that we've got on top of the community transmission there. Corby, as I said, has seen that significant increase in the last week, and Kettering's increase has been more steady, but has now got to a point where obviously the Chief Medical Officer has felt it necessary to add it to the watch list. In the last 28 days, again, Cliftonville and Rushmere are continuing to feature on areas that are being most effective, Kettering Town and West, Victoria and Isbrook as well. So again, we're focusing efforts around communication, engagement and enforcement in those areas. So to quickly summarise our outbreak position, at the moment we have 22 outbreaks that are active in the county. At the moment, the area most affected is Northampton, just simply because of the density, number of care homes, number of places of work, etc. So that's reflective of the obviously number of residents. Of the 22, 10 are in care homes. Again, we know that we're obviously undertaking that routine surveillance. So those are small numbers, none of those are of concern. 8 in the workplace and 4 in other settings. Exposures are going to stop being reported to local authority public health teams, and Public Health England will just monitor those. So those are single cases where there's been potentially exposure to other people. So what Public Health England will do going forward is obviously keep that information on record. If they find any cases obviously transpire from that exposure, then we would be notified of both the exposure and the any related case. But just simply because of the sheer numbers, people will have noticed that the number of exposures has gone up significantly over time. It's something that they're unable to report on a regular basis, but obviously will notify us if those exposures start to produce a community transmission issue. From a point of view of clusters, we obviously have very few at the moment, 1 in the workplace, which obviously is being addressed. So overall, we've got a really good picture from a point of view of testing, which obviously Sharon will go on to explain in more detail. Very positive rates of testing that we need to be able to maintain. Obviously, that is helping us identify where those cases are and where those people obviously are then, as appropriate, isolating. We're able to start to see our case numbers drop off in some areas where people are stopping that onward transmission. Still some way to go in Kettering and Corby, but obviously we've demonstrated in Northampton we can get on top of the curve. We just need to be able to maintain that position. So reminding people of the importance of seeking testing as soon as they possibly can if they develop symptoms, and self-isolating.
Thank you very much, Lucy. A very good summary of the data as it stands. I'm looking around the room to see if there are any questions. There don't appear to be any hands up, so I will move straight on to testing update from Sharon Wright. Good morning, Sharon.
Good morning. Problems with my video this morning, apologies. So testing in the pack, you can see that there are the numbers there. We're remaining steady with our testing capacity. Or our testing rates. The capacity in the system in the laboratories is causing some problems nationally as well as locally, and for that reason the new comms that you will see go out does point to making an appointment, and that is really important at the moment with the capacity issues, because the appointments that are being released will match the capacity. As we were in an area of intervention, our message was that if you are concerned, to get a test. With the capacity issues, as Dr. Chris Whitty and the Prime Minister indicated in their briefings over the last 48 hours, is that we really must move away from just being concerned to making sure that the testing is available for people that really need it, and that if you have got symptoms, even the mildest of symptoms, then go forward and get tested. People may find that there is a problem initially around getting an appointment, and they may well be directed to further afield. Appointments do come online in the evening for the following morning. So you'll see within the comms that is going out is asking people that to try around between 6 and 8 p.m. in the evening for the following day. Throughout the day, appointments are released, but obviously that is a staggered approach. To try and match the capacity, and at a point in time when the capacity is at its levelest, then we will have to close the appointments down. Northamptonshire has been prioritised, but the amount of people that are going through our testing sites is quite large. Looking at the data nationally, we are one of the highest areas in the country for testing, and the UK is one of the highest areas in Europe, actually matching the testing capacity in the United States and equal to that of Australia. So in light of that, we have got more capacity coming online across the country with the Lighthouse labs, and locally to Northamptonshire, we have got a lab in Loughborough in the Charnwood area of Leicestershire coming online at the end of the week, which will help us with local capacity issues. So despite noise in the system, there are appointments available across our local testing sites. We have 4 of those, and also our MTUs, which are rotating around the county. And our regional testing site comes online today at Kettering Conference Centre. So we have got availability. It is a matter of keep trying to get a local appointment, and really only go for an appointment if you have got symptoms.
Thank you, Sharon, for that update. I think, yes, victims of our own success in terms of testing in many ways. We're obviously doing a very good job of utilising those testing facilities. So I'm just looking around the room to see if there are any questions for you, Sharon. Doesn't appear so at the moment. Thank you very much, Sharon, for that update. We look forward to more information coming back next week on what's happening with the lab situation and testing appointments and things like that. But the advice is quite clear to try at certain times of the day to get your appointments. They are available. Thank you, Sharon. I'll come now to the comms and engagement update. I think I've got Claire Hughes down here, but I think it's actually Sarah. Are you on the line, Sarah? It would appear not at the moment. I'm going to, hello, is that Sarah?
Yes, can you hear me?
Yes, we can. I'm so sorry. I know you've had some
Apologies, I've had to dial back in. Yeah.
That was you. Hi, Sharon. Sorry, Sarah. Carry on.
Right, I'll go. So this week, the COVID Communications Cell has been working together with district and borough colleagues again to ensure all activity is delivered across the county. The focus is currently Northampton, Kettering, Corby, Wellingborough, South and East Northampton, Daventry. But we are also meeting comms colleagues in all districts and boroughs regarding outbreak scenario planning. We're continuing to update the testing webpage and social media, holding the weekly press conference, sharing the data surveillance report on the website and with the media. Lucy, the Director of Public Health, Lucy Whiteman, the Director of Public Health, is still giving twice weekly interviews to BBC Radio Northampton. We're working with our hospital trust colleagues and have produced digital slides with all our messaging to appear on their patient-facing digital screens. We're continuing to work with the business community and employers of agency staff. There's a weekly webinar and ongoing promotion of our business packs, which are continually updated with translated materials. We're continuing to promote testing with updated messaging communication surrounding that. We've printed and distributed a poster aimed at those playing sport. Lucy Whiteman shared it with the imagery with you last week. There's now both a one for adults and children, which has been distributed to all sporting organisations. There are bollard banners appearing in all Kettering Borough Council's car parks. Well, they're going to print this week actually, so they should be out on display soon. I'll confirm with you once they are. Last week we commissioned a geolocate service in Corbury and Kettering, which guaranteed over the 2-week period 500,000 impressions in each town. We're working to produce an animation which will show visually the single chain of virus transmission from one person to person across settings and how rapidly that can happen. Regarding specific work with our BAME communities, there's ongoing translation materials into print, audio and visual formats. We're currently working on a Punjabi translation of a video for Kettering and Corby. We're launching a new infographic tomorrow with data from the surveillance report, which clearly sets out the numbers week on week at a glance. And we have targeted paid for social media. We've got continuing focus on the messaging for our younger population, and we're surveying the younger audience to draw down exactly what messages would resonate fully with them. We've increased social media and messaging for younger people in Kettering, Corby and Northampton and Wellingborough specifically with the hashtag NorthHantsTogether imaging. Pop Central nightclub in Kettering has offered their big screen to us for our messaging to appear on. And we're continuing to work with the University of Northampton to align messaging with the student population due to return shortly. Research is being carried out via an online survey and focus groups with those in their late teens and early 20s or 20 to 29-year-olds in particular. Education resources have been produced and distributed for early years, primary, secondary and university students, and we're preparing more specific graphics targeted at those in their 20s and 30s to be distributed on social media. Given the Prime Minister's announcement yesterday, our message in the weeks ahead will be tailored accordingly. If there are any questions, then I'm happy to take them.
Thank you very much. Yes, I do have a couple of questions for you. I've got Councillor Danielle Stone and then Councillor Phil Bignell. If we start with you, Danielle.
Lovely, thank you. Just a quick one. In terms of the comms addressed to young people, you may not know, but we've got a very lively network of youth providers in Northampton that actually have a huge reach. So giving them the materials to circulate or inviting them indeed to help produce the materials would be excellent.
Okay, that would be great.
Very good idea, and I'm sure you'll pick up on that, Sarah. And if Danielle can help with that in any way, I'm sure you'll. That would be
fantastic. Thank you.
After the meeting, that would be brilliant. Phil.
Yes, thank you, Chair. It was about the geolocate, which I believe was launched last weekend in certain areas of Kettering, Corby, Northampton, etc. I wondered how successful that initial launch was, and what the results was against expectations, please, Sarah.
Well, we were guaranteed 500,000 impressions, so I'll have to make sure that's happened at the end of the 2-week period. I'll just have to check in and make sure that data did actually. I mean, how they do it, I'm unsure, to be honest. It's all new to me. But rest assured, I will follow up on that.
It's just how are we going to measure the success of doing it in terms of what is the expected outcome? Is it an increased number of tested, increased number of what? I mean, what is the ultimate measure that it's worked, I guess?
I guess the measure would be higher numbers of testing and a greater adherence to the behaviours which we're promoting. How we measure the greater adherence to the latter, I'm unsure. But I suppose ultimately you would measure it 2 weeks from the 2-week period to see if the virus amongst that age group had reduced. It's very difficult to do, really.
Thank you, Sarah. That's very useful information. But can you come back to the next meeting perhaps with some update on what Phil's referred to there on the hit rate? And Lucy wants to come in anyway. Lucy.
Hi, I think Phil obviously asks a very insightful question, and it's one of the things that we've been talking to our military liaison support workers about. So one of the things that we're obviously keen to do is make sure that we're targeting our communications and our engagement, and like you say, that it's generating an action, be that to go and seek testing, to obviously by word of mouth communicate what the current restrictions are locally, or obviously in relation to translation into action around enhanced compliance. The challenge is being able to demonstrate a link between any of the activities that we're undertaking and those outcomes. As Sarah says, I just did what you did. As Sarah says, what we obviously will be able to do is look at whether we are starting to turn the trend in the particular age groups that we're targeting. The other thing that I think we can do, and I would ask Chair, if we can, that we request this for the agenda next week, is a summary of some of the impressions and clicks and all of the other sort of targeted comms and social media impressions that can be counted, that is brought back to us. I know previously, particularly when Northampton went on to the watch list, and obviously when the Secretary of State laid his order around Green Corps, we saw a significant number of visits to our website. So I think it would be useful to have that kind of data reported through around comms on a more regular basis, and perhaps that would give us a bit of a summary, Phil.
Thank you very much, Lucy. That's a very good idea. Let's make that an action point to bring to the private and the public meeting, so that we can share that data with the public as well as with councillors. Obviously, we've got one of the highest testing rates in the country, so we're already doing, our messaging is getting out there, because we wouldn't have such a high rate. But it's a very interesting point to see if it goes higher, is it as a result of what we're doing further? So I think it's a very interesting point. Sarah, did you want to comment on that?
No, only that I'll ensure that data is brought to the next meeting. Yeah.
Thank you very much. That would be very, very helpful indeed. As I say, we do have a very high testing rate anyway, so it would be great to see that messaging that's been very consistent, and you've outlined very clearly a very detailed plan of comms that has continued since this crisis started here in the county. So I think the comms team have done an amazing job. We're just building on that messaging, really. So if we could bring that back, that would be amazing. Thank you very much. Thank you, Sarah. I'm coming now to any other business, which is item number 15. Lucy, did you have any other business that you wanted to bring up today? Thank you.
Just apologies for the next 2 weeks meetings, as I will be on annual leave. Obviously, I will have one of my consultants deputising, but just obviously everybody will keep you up to speed in my absence.
Thank you very much for that, Lucy. And if anyone deserves a little break, it is definitely you. You have worked extremely hard over the last few months, and we thank you very much for all your hard work. And I'm sure your colleague will step into the breach, and they will not be as good as you, I'm sure, will do a very fine job. Is there any other business from anyone else? I'm just looking around the room. It doesn't seem so. So we come to item 16, which is future meeting dates. We have 2 so far, which is the 18th of September at 9 a.m. and the 25th of September at 9 a.m. They're already in everyone's diaries, but I'll just remind everyone of those here now. On that note, I think I can close the meeting. Thank you very much, everyone, for attending. Thank you for your questions. And Lucy, as ever, thank you for your insightful reports, and from the other team members as well. And I hope you enjoy your 2-week staycation at home, and hopefully you will switch your phone off, hopefully, and you will do some other things other than public health for 2 weeks. Thank you very much. Thank you, everyone.
Thank you.
See you tomorrow at the press conference for those that will be dialing in for that. Thank you very much. Have a great day and have a lovely weekend.
Bye-bye.
Hold on, Ian.
Bye-bye.